everyone. Welcome to the PPS-STC YouTube channel. Today, we're going to talk about epilepsy. The National Epilepsy Month, which is celebrated every September in the Philippines, is an annual event where the epilepsy community comes together to raise awareness about what living with epilepsy is like. This event aims to raise awareness among people about this brain disorder called epilepsy. It is an opportunity to increase public's understanding of the disease and to eliminate the fear and stigma associated with it. Epilepsy can be dealt with if diagnosed and treated accordingly. Again, welcome to the PPS-STC YouTube channel. I'm Dr. Madeleine Grace Sosa, a child neurologist, and I hope you will learn from this video presentation. Thank you for watching.
Magandang araw po sa inyong lahat. Tuwing September po, sineselebrate natin ang National Epilepsy Awareness Month. Ito po ay sinasagawa ng maraming organisasyon tulad ng Philippine Neurological Association, Child Neurology Society Philippines, Philippine League Against Epilepsy, at ngayon po ay ang Southern Tagalog chapter ng PPS ay makiki-participate na po sa ating National Epilepsy Awareness Month, which is every September po. So, sana po marami tayong matutunan sa konting information from our speaker, Dr. Latorre. At sana po magamit nito kung meron po kayong mahal sa buhay o kakilala na merong epilepsy. Magandang araw po.
Magandang araw sa inyong lahat. Ang paksa natin ngayon, araw ay tungkol sa epilepsy at paano natin mapapangalagaan ang isang taong may kondisyon na ito. Isang kailangan nating isipin at tandaan na kapag nalaman natin ang isang kamag-anak ay may kondisyon na seizure or epilepsy, hindi tayo dapat matakot dahil mawawalan tayo ng presence of mind. Isipin natin na maaari tayong makatulong kung may magagawa tayong mabuti at maiiwasan natin na lumala ang kanilang kondisyon lalo na kapag sila ay inaatake. At bago natin diskusyonin ang mga detalye kung ano ang dapat nating gawin, mabuting intindihin natin ano nga ba ang epilepsy. So what is epilepsy? Now, epilepsy is one of the most common neurological conditions affecting children worldwide. Isa siya na kondisyon na nakakabahala kapag sinabing may seizure or epilepsy ng ating anak. But importanteng malaman natin at kapag buo ang ating presensya ng ating isipan na mapapangalagaan natin ang ating mga anak sa kanilang kondisyon. Dahil epilepsy ay isa sa pang-apat na pinakapangkaraniwang sakit na naapektuhan ang utak ng lahat ng tao, bata o matanda. Epilepsy is characterized by an unpredictable seizure which can cause other health-related problems. Okay. Now, epilepsy can be a spectrum of conditions with wide range of seizure types and control varying from person to person. And therefore, public misunderstandings about epilepsy and their care can cause challenges that are often worse than the seizure itself. So what is seizure and what is epilepsy? We have to take note that seizures and epilepsy are not always the same, because seizure is a transient occurrence of signs and symptoms due to an abnormal, excessive, or synchronous neurological activity in the brain, while epilepsy is a disease characterized by an enduring predisposition to generate epileptic seizures and caused by neurobiological, cognitive, psychological, and social consequences of this condition. Therefore, seizure is an event of the attack, while epilepsy is the disease involving recurrent unprovoked seizures. Now, a person is considered to have epilepsy if they meet any of the following conditions. First, they could have at least 2 unprovoked or reflex seizures occurring greater than 24 hours apart. Another is 1 unprovoked or reflex seizure and the probability of having another attack similar to the general recurrence risk of after having 2 unprovoked seizures occurring over the next 10 years. Or it is a diagnosis of an epilepsy syndrome itself, meaning there is the tendency already based on the other pre-existing conditions that the child may be developing epilepsy. Whenever we are confronted in a patient who had seizure, and if a parent would bring their children for consult, one of the most common thing that you would observe is that the doctor would be so meticulous in asking for the history of the seizure in terms of its character, frequency, duration, what could be the precipitating factor, ano yung ginagawa ng pasyente bago atakihin, anong nangyari pagkatapos. Why are these details important? Is because we have to know the epilepsy type and epilepsy classification for proper choice of management, diagnostics, and medicine to be taken by the patient. It is important, like in this slide, the seizure types. It is important to know whether the epilepsies are classified into focal or generalized or both, because depending on the type, it also depends on the proper anti-seizure medications to be taken by the patient. Or the patient may belong to the different epilepsy syndromes all along. So it is very important for us to be able to detect these, as these may help us curtail or specifically choose the proper anti-epileptic drug or medications to be given right away. And we have to know the different etiology. Ano ba ang dahilan? Bakit sila nag-seizure? Ito ba ay dahil meron talaga sa history sa pamilya, which is genetic, structural, may problem sa pagkapanganak, may problem na ang development ng brain itself, metabolic, yung mga blood sugar o yung ibang asin sa dugo, immunologic, or infection. Now, on the left, we have to take note the comorbidities, meaning the pre-existing. Bago pa mag-seizure, ano ba ang kondisyon ng pasyente? Sila ba ay delayed in their development? Sila ba ay behaviorally challenged? May kondisyon na sila kagaya ng autism or ADHD or ibang mga kahalintulad na kondisyon kagaya ng mga may ibang behavioral problem, language delay, intellectual disability, or any other general condition. Bakit? Because this would also help us and guide us in the proper management. We need to take note also of the different medications that they have been taking before they had seizure, so that we would know if these drugs that they're taking would be having drug and drug interactions if ever we start with a new medicine, which is for seizure. Now, what happens during seizure? Okay? Seizures can take on many different forms, and seizure can affect different people in different ways. Now, not all parts of a seizure may be visible or easy to separate from each other. Every person with seizure will not have every stage or symptom. There are three phases. First phase is an aura, which is a warning sign or symptom, and is considered the earliest part of the seizure. Take note that not everyone would have an aura, but most common scenarios that patients would tell us that they have seizures or have an aura before their actual seizure attack would include blurring of vision, dizziness, headache, or sometimes flashes of light. Okay. Now, the middle of the seizure event is called the ictal phase, which is the more important and most overt or obvious seizure manifestation. And this correlates with the abnormal electrical activity in the brain. This is the most common attack or phase of the attack of the seizure that most of the caregivers are so worried about. Natataranta na lahat. No? So kaya, yung first phase actually hindi na napansin. Pero itong phase na to, which is the ictal phase, ito yung napapansin natin. Now, as the seizure ends, the post-ictal phase occur. And this is the recovery period after the seizure. There are some patients who, after the ictal event, would have a very short post-ictal attack or post-ictal phase na gising agad sila or naka-recover sila. But most of them, they don't have the recall of the event. So hindi nila alam na inatake sila. Anong nangyari? Sumakit ang ulo ko. Yun lang ang natatandaan nila. While others, it may take them minutes or hours to feel like their usual self. Now, none of the other things that we have to take note of is who gets epilepsy. Epilepsy and seizures can develop in any person at any age, and they are common in younger children or older people. 1 in 26 people may have developed epilepsy in their lifetime, and people with certain conditions may be at greater risk. Each year, 48 for every 100,000 people may develop epilepsy. Now, in the US, at least 3.4 million of those in the US live with seizures, including 470,000 of which are children. Now, in the Philippines, approximately 1 million Filipino children are affected, and more than 65 million are people with epilepsy. What causes seizures and epilepsy? Now, we have to emphasize here that cause is different from the trigger. Okay. Now, what causes epilepsy? It varies from age to age of the person. Some people with no known cause of epilepsy may be of genetic predisposition or genetic cause. 30% may have a change in the structure of their brain that causes the electrical storms of seizures. Some young children may be born with a structural change in the area of the brain that gives rise to seizures. And about 30% may have other behavioral conditions like autism spectrum disorder. Infections of the brain should never be missed out, as their complications may predispose the patient to develop epilepsy later on in life. People of all ages can have head injuries, though severe head injuries happen most often in younger adults. In middle-aged population, strokes, tumors, and injuries are most frequent causes. And in people over 65 or those who are in their senior years, stroke is the most common cause of new onset seizures. Now let us briefly discuss common causes of seizures according to the different age group. In newborns, aside from the structural brain malformations, One of the most common that we have in our Philippine setting is perinatal asphyxia, especially for those who had difficult delivery or non-institutional birth with associated low Apgar score, or usually in the history, they would tell us the baby was blue, hindi umiyak, or nangitim pagkapanganak at matagal umiyak. It may connote that there was lack of oxygen during birth, and therefore the brain is hypoxic. Low levels of blood sugar also may cause the newborns to have seizures associated with other electrolyte problems. Inborn errors of metabolism, intracranial hemorrhages, and maternal drug use are not to be left out. Now, in more older infants and children, one of the most common seizures in this age group is febrile convulsion. But we have to bear in mind that not all children who have febrile convulsion would automatically mean that they would develop epilepsy. No, because febrile seizures usually happen to a normal, neurodevelopmentally skilled children with a higher propensity for those who have family history of febrile seizures, and it happens to children most commonly in the age of 6 months to 6 years. Other causes of seizures in the infants and children age group include brain tumors and infection. Now, in more older children and adults, congenital conditions, genetic factors, progressive brain disorders, and head trauma may be the culprit. Now, for seniors, to name a few, stroke, Alzheimer's, and trauma are the most common reasons why they could have seizures. Now, what about triggers? As I've said, triggers are different from causes because seizure triggers are factors that precipitate or provoke the seizures. They may make a person with epilepsy more likely to have seizures in certain situations, and this could change the number and severity of the seizure. It is important that we learn what triggers the seizure so that it would help us what to do next and what precautions to take. Modifying lifestyle or the environment can lessen the risk of the triggers. Now, what are specifically the seizure triggers that can happen? Okay. Mismedication. So what happens in mismedication? The patient already is on regular maintenance medication, but they would observe themselves, or even the parents would notice the patient is seizure free for several months already while on the intake of the medication. So they would abruptly stop the medication, and that could trigger a seizure event, which is withdrawal seizure. On the other hand, more commonly, the patient would have erratic compliance in terms of the intake of the medication. That per se can trigger the seizure. Now, lack of sleep or disturbed sleep also can trigger the seizure. So it is very important that children and the parents would be knowledgeable in terms of the proper sleep hygiene and the proper time of letting their children go to sleep, and that proper time or enough time before we wake them up. Other seizure triggers include illnesses, both with or without fever, and psychological stresses. And not to be missed out include heavy alcohol use or seizures after alcohol withdrawal. And likewise, the use of illicit drugs. To some patients who use illicit drugs, most often than not, have a hard time in controlling and treating their seizures. Likewise, over-the-counter drugs, prescription medications, and supplements that decrease the effectiveness of their seizure medicine can trigger their seizure attacks. Other seizure triggers include nutritional deficiencies like vitamins and minerals, poor eating habits such as fasting and dehydration, hormonal changes can trigger a seizure, flashing lights, and specific activities like noises and food. We have often been asked, Doctora, Doctor, can my child still go on online classes kasi gagamit siya ng computer, gadget, no? At this point, may maintenance siyang gamot kasi may epilepsy siya. Okay? We tried to adapt in our advice at this time, especially during this time of pandemic, that we can allow our children who are in regular school to engage in online classes as long as they would observe proper gadget hygiene. What is that? They should only use the computer, the gadget, during the time as a means to communicate. But other extracurricular activities that would predispose them to use the gadgets, the computer, the TV, the cell phone, the iPad, other than school-related activities, as much as possible, we limit or do not allow them. Okay, like just watching YouTube or online games, we don't allow them as much as possible because of the principle of the flashing light and the movement patterns, which can trigger, especially for those who have photosensitive type epilepsies. Okay? So it's not per se that if they use the gadget, if they use the computer during online class, that's the reason why they had seizure or they had epilepsy. No. But the excessive use of the gadget can trigger their seizures because the flashing light or the different patterns that moves during the time that they're using the gadgets or the cell phone or computer is the one that triggers them to have the clinical seizure event. But as a means to communicate, as a means to learn, we may use with precaution in terms of taking note the duration of their use of the gadget. So they may still be allowed to continue their online learning, okay, with a little precaution into the duration of their use. Another issue to be tackled includes inheritance of the epilepsy. Though, meron po kaming mag-anak na alam namin may epilepsy. Or minsan tatanungin natin ng pasyente, sa inyo po bang pamilya, sa side ng tatay o ng nanay, meron po bang nagsi-seizure or may epileptic? Bakit importanteng malaman po ito is because heredity or genetics or the physical traits that we get from our parents play a very important role in terms of knowing the cause of epilepsy. And it has been found out in many studies that generalized epilepsy compared to focal epilepsy is more likely involved to have a genetic predisposition. There is a slightly higher risk for siblings to develop epilepsy since they may be genetic tendency within the family for those who have seizures or epilepsy. Though we have to take note that epilepsy is not contagious and the people cannot catch it like a common cold. So it doesn't mean that if one family has it now, okay, mahahawa siya o mahahawa yung mga kasama sa bahay. Hindi po siya ganon. But we have to bear in mind that if it's genetically related, okay, it is there within the genes of the different generations in the family. So chances are that it may be passed on is possible. Next question. Will I always have seizure? 60% of those diagnosed with epilepsy can become seizure-free within a few years with proper treatment. And many of these will never have any more seizures. Now, for the rest, some will have occasional breakthrough seizures or side effects of the medicine, and others will have uncontrolled seizures. Outlook in the first year for people with newly diagnosed seizures include the following. 50 to 60% will be seizure-free after using the first medication. A second seizure medication may help in 11 to 20% out of 100 people to become seizure-free. And this percentage goes down as more seizure medication is added. 25% of the adults will develop further seizures. And in children with new onset seizures, 74 out of 100 may become seizure-free within 2 years. Uncontrolled epilepsy may be seen in 9 out of 100 children, followed for a number of years. Outlook for people with seizures in epilepsy at any point in time includes 60 to 70% may get control of their seizures after a number of years. But we don't know if this means complete control of both seizures and side effects. At least 30% with epilepsy at any point in time have uncontrollable seizures, and 50% of these with epilepsy report bothersome side effects with their seizure medication. Factors that may improve the chance of being seizure-free include the following: having a positive response to first or second medication of seizures that have been employed, no known history of brain injury or abnormality, a normal neurologic exam, and EEG, no family history of epilepsy, and having an unknown cause of epilepsy. Well, I have to stay on seizure medications all my life. Okay. Patients usually ask once they are about to start the medication, so how long? If seizures would go away, you may be able to get off your seizures medication, and if you have been seizure-free for at least 2 to 5 years. But take note, you always have to have your doctor's advice. The length of time a person is seizure-free before stopping his medication depends on many issues. The longer time a person is seizure-free on medication, the better of the chance that she is coming off with the medicine totally. 50 out of 100 children will outgrow their epilepsy. And people who have surgery and become seizure-free may be able to come off with their medicine. However, some stay on with their medication to prevent the seizures from coming back even after surgery. Now, how serious are the seizures? Well, most seizures end on their own. During some seizures, people can injure themselves though and develop other medical problems or life-threatening emergencies. That's the reason why if our patient would have the sudden seizure attack, it is very important for us to assist them. And how do we assist them? Okay. To some children or early young adults or adults who would recognize that they have the aura, which is the prelude to their actual main seizure event. If they experience such aura manifestation, they can already secure themselves, no? Sitting down or lying down already in bed or in the sofa, so that they would be able to lessen the chance of hurting or getting trauma while during the seizure event. Now, for others who we always see the ictal event, no, the presence of mind is very important at this point, especially for the caregivers and the parents. It is important to lie them on their side, either on the right or most likely on the left. No? Lie them on their left, straighten up their neck so that the airway would not be compromised. Okay? It is not advisable to put a tongue guard or spoon or anything to bite into the mouth because we may be able to push back the tongue, which may obstruct further the airway. Okay, from the nose passing through the nasopharyngeal area towards the lungs. The overall risk of dying for a person with epilepsy is 1.6 to 3 times higher than for the general population. SUDEP is likely the most common disease-related cause of death in people with epilepsy. It is not frequent, but it may be a very real problem, and people may need to be aware of this risk. On the next few slides, we shall be discussing what are the facts and what are the myths. Okay? Ano yung mga sabi-sabi tungkol sa seizures in epilepsy. Isa sa mga common na sabi-sabi ay pagka ang isang tao ay may epilepsy at inatake, posibleng sira ulo yan, mentally ill, or emotionally unstable, kaya ganyan yan. But ano bang totoo? Ang totoo ay epilepsy is a functional physical brain condition. It is not just a mental condition. Bakit nagkakaroon sila ng emotional instability? Bakit nagkakaroon ng parang kakaibang pag-iisip ang isang taong may epilepsy? Sa iba, because of the chronicity o tagal ng sakit nila, nagkakaroon sila ng tinatawag na psychiatric comorbidity such as anxiety, depression, or aggression. Or yung iba, yung nagiging emotional unstable sila because of the side effects of their medication that may likewise cause their symptoms. So ibig bang sabihin kung ganito, kung dahil sa gamot, ihihinto na lang natin ng gamot? Hindi po. Marami pong pwedeng ipalit na gamot kung hindi nila matolerate o kahiyang yung kanilang gamot para sa epilepsy. Or, bago palitan, minsan ina-adjust lang po muna ang dosage ng gamot. At kadalasan, sa pag-adjust ng gamot, naaayos po ang lahat. Ibig sabihin, hindi na sila inaatake ng kanilang seizure sa epilepsy at hindi na rin sila ganoon anxious, depressed, or parang laging magagalitin o laging hyper. Another myth is that people with epilepsy aren't as smart as other people. Is that true? Actually, what is true is that epilepsy has little to no effect on the person's ability to think, except during the seizure event, during a short period following some seizures. Because most of the time, during the seizure event or immediately after the seizure, they may have altered sensorium. Or again, sometimes as a side effect of certain anti-epileptic medication. But then again, it doesn't mean that we have to stop the medication. We can adjust the dosage or change into another best available anti-seizure drug. Other myths include seizures hurt. masakit daw pagka nag-atake yung seizure. But actually, a person is usually unconscious or their awareness is altered during the seizure. Okay. Afterwards, the patient could feel discomfort, has muscle pain, or if they bite their tongue. Okay. Again, how do we address the chance of the patient to bite their tongue? Proper positioning. It's not by putting a spoon or a tongue guard onto the mouth. Okay. Another myth is that people with epilepsy are cursed. No, epilepsy is not a curse, nor is it a punishment from God. But epilepsy is a medical condition that needs to be treated. People with epilepsy can continue to have a normal, productive, and happy life. The importance of getting proper treatment and adherence to medication cannot be overly emphasized. Epilepsy should not be a barrier to achieving a productive and fruitful future. The person's quality of life, however, may be affected by the frequency and the severity of the seizures, the effects of the medication, and the associated neurological disorders. Therefore, it is important to know that some types of epilepsies are more difficult to control than others. And this poses a greater challenge to the doctor in order for us to be able to treat the seizure condition and increase the chances of the child or the patient to have a productive life. At this point, okay, ako ay umaasa, okay, na naipaliwanag ng maigi at naging malinaw ang tungkol sa seizures at epilepsy, na kahit papaano, sana ay mas naliwanagan ang mga nakikinig at mas naging mapanatag ang loob kung papaano uunawain at aalagaan at ano ang posibleng kahahantungan ng paggagamot ng isang pasyenteng may seizure at epilepsy. Maraming salamat po sa inyong pakikinig.